Tell me about yourself. My name is Ellena. You can call me Ellen. I'm graduate from Poltekkes Tasikmalaya on nursing program. I ever had work in RSUD Gunung Jati for 1 year as a nurse. When I'm in college, I joined organization and served as general user. I like to make poster in design and I'm mastering IT. Why did you decide on a career as a nurse? I decided to become a nurse because I want to help others who were sick. I felt happy when I could see the patient or their family smiling when patient recovered. Tell me what you feel your greatest skill as a nurse is. I'm proud of my ability to look for any patient issue so that when patients go home, they will completely recover. How do you handle the stress of the job? I usually make a priority scale of what patient need and what can I do for this patient. Are you comfortable to work with other doctor and nurse? Yes, miss, I can work individually and in a team. I used to work in a team since I was a nursing student and I joined student organization and often be a committee of an event. What do you find the hardest thing about being a nurse? The hardest thing I felt while being a nurse was the responsibility of a nurse for the patient. Therefore, I will try my best for patient. Are you the best candidate for this position? I have worked as a registered nurse. I expert in the fields of surgical nursing and medical emergencies, but I will always opportunity to learn and develop and be open to change. What do you want to work here? Choose this company because it is an international company and a pioneer of emergency evacuation in Indonesia, and I want to take part in the development of health in community, especially in medical emergencies. Describe a time you had to deal with a difficult patient and how you handled that. Working with elderly patient presents unique challenge. I remember an elderly patient. He likes to move his arm and make the IV catheter come loose. I tried to replace the IV catheter and put it back again by bandaging the patient's hand to minimize the risk of catheter being released again. I tried to talk with that patient and asked to his family to accompany the patient. This method success in making the patient a little calm. Do you have any question for us? I have a question, miss. If I work here, what salary do I receive? I want a salary that match my perform and my abilities.